Today we got some new data on the burden of liver disease in Europe, and that's quite a powerful tool for lobbying political activity, for lobbying for increased resources from the research funding community, and also for lobbying for new policies from DG Sanko and other public health authorities. So we've been waiting for this data for some time. We know that people react to this sort of data in a positive way. They recognize with published data that there is something that they have to address. We have faced in a number of times when lobbying in Brussels or in Strasbourg, we've been noticed that people don't take liver disease seriously because they don't appreciate how big of a burden that liver disease exerts on the European population. And when you start to see figures like 6% of the European population, 29 million people affected by liver disease, the politicians, the civil servants, etc., they have to wake up.
I think it's very important that we pull together all of the different strands of research that are already published out there to give an indication of the true scale and the potential scale of the problem we face here. The point was made during the conference today that there's a tremendous amount of unpublished data as well in the ministries of health around the European Union. We need to gain access to that under transparency rules and bring that out into the open as well. Then we can get a true assessment of the scale of the problem we're trying to tackle here. It is cross-party. I think it's very important that we recognise that members of all political persuasions are interested in tackling this very serious issue, but also cross-committee. As I mentioned, members tend to concentrate in one particular area of policy to the exclusion of virtually all else in terms of budgetary terms and in terms of research. It's important that we get them to recognise that we need some joined-up thinking here. We need to get people out of those separate committees to join together the public health interests with the employment interests, with the internal market, unit pricing for alcohol, for example, elements of the problem, to tackle it more holistically.
One very important issue is that you know the size of the problem, and therefore we produced this literature review to look at the incidence of the disease in Europe comprehensively, because you have data bits here and there, you have different ways of reporting, so we were trying to make a standardized report to give incidence rates in the same measurements, so that you could really compare in between different countries, between the different disease etiologies, and have actual data for Europe, because in the literature oftentimes you just find data for individual countries, oftentimes just for the US, and that's of course not totally different from Europe, but still we need data of the European dimension of the problem in order to act at the European level.
We are trying to draw attention to the patients with liver disease, because in our everyday practice we measure how much is missing from the political environment, and probably we realize that the lack of awareness from the public, from the policymakers, and even from our peers, the doctors, that it's like the liver was forgotten. And we believe that the liver was forgotten because of silence.
Well, actually, I'm not a scientist. I serve ESOLS now almost 8 years, and it's a fantastic opportunity for us to actually develop a real tool, communication tool, to express on, let's say, normal understanding words what is about liver disease. And for me, it's an amazing chance for us to be now in the EU Parliament, to have the chance to talk about that to a more worldwide audience. This is the place to be. I mean, this is the central point of Europe, and there is no other places than here to do this event.